My name is Gabrielle Rocque, and I'm an assistant professor at the University of Alabama at Birmingham. Perhaps the challenge that we faced with OCM that we needed the most support on was the use of treatment plans. So as part of OCM, we are asked to provide patients with treatment plans that cover the 13 elements recommended by the Institute of Medicine. And we very early on recognized this as something that was going to be challenging at UAB. So fortunately, we had the opportunity before the oncology care model started to participate in a pilot program with a company called CareVive. And we worked with them to develop a treatment plan which would be given at the time patients are starting their active cancer treatment that would meet many of these requirements. And so the idea is that patients fill out survey and other important information on an iPad while they're waiting in the clinic. And then that information gets merged with clinical data to provide them a patient-specific treatment plan that includes information about who's on their care team, anticipated side effects, as well as some basic symptom management. So we worked with them on that treatment plan, and we're really pleasantly surprised at the positive response we had both from patients and from our clinical staff. So patients really enjoyed the extra education and that extra attention to both their symptom management as well as their other kind of multi-disciplinary needs. At the same time, our physicians really liked it. It was a system that was relatively easy to use, and they enjoyed having that extra support and extra education provided to the patients as well.
Okay, so we use Cerner at UAB. Why didn't we just use Cerner for this?
So there are several reasons why it was an advantage for us to use something like CareVive rather than Cerner. First, within Cerner, there are some difficulties with getting changes made. It has to go through a lot of different levels to be able to make a completely new product. And you really need to use the existing infrastructure of Cerner, so everything will look similar within Cerner to the way your notes or other templates might look. In contrast, CareVive has a very patient-friendly, aesthetically appealing platform that really wouldn't be possible to do within your existing medical record. So it's better to be able to interface with Cerner or Epic to get the data elements out, but be able to use the platform that really is going to work the best for patients. Another one of the key advantages that I see with having something that is to some extent external to the medical record is that if it can connect to the medical record but can be used for different medical records, that gives us an ability to share some data elements with our partners. And an example of that is within the UAB Health System Cancer Community Network, we actually have several sites that are utilizing CareVive right now. And they're on different medical records, but we are going to be able to share both data from the platform as well as be able to think about some innovative research projects. And that's really important in the oncology care model and other value-based payments in that we are learning from each other and we're understanding how to implement some of these projects together despite our differences. So I think that being external is very important. However, it's also equally important that it does interface with the medical record. So we have spent several months working with Cerner as well as with CareVive to interface so that when clinicians enter information into Cerner that can be directly passed to CareVive. Because what we don't want are physicians being asked to enter staging information and other clinically important information twice into two different systems, because that would be a huge workflow barrier for us at UAB.
What about some of the other issues that we have to meet in OCM, like survivorship plans?
So survivorship care plans is actually a part of the 13 components of the Institute of Medicine's plan. And so what we're doing is utilizing the same platform, the same data to provide both the upfront treatment plan as well as the survivorship care plan at the end of treatment. So the idea is that information will already be in the system, and it's really going to be a seamless transition as patients go from active treatment to survivorship and get these treatment plan and survivorship care plans sort of on the bookends of their drug therapy.
any major obstacles, or what's our implementation plan at the moment?
So our implementation plan at the moment is we're working through some of the sites localization, so putting our specific resources into the treatment plans. We're also continuing to work on our interface so that the data flows seamlessly from Cerner to Carevive, and then once the treatment plans are made, those will come back into Cerner and be able to be pushed out through our patient portal. So we're working on some of the logistics of that integration right now, and we anticipate really rolling this out first in breast and gynecologic cancers next month.